All right, good afternoon, everyone. Mayor Jane here. Thank you again for joining us for our daily Facebook Live updates. I really appreciate all of you tuning in here. Very much appreciated. Our guest today is the amazing State Senator Janet Cruz,
Thank
and
you, amazing mayor.
we will get to her in just a minute. Um, so the COVID updates is what I always start with. We have 1,124 total cases in Hillsborough County, and still we have 23 deaths. And that is a remarkably low number if you look nationwide, but still every one of those numbers represents an individual who has left behind loved ones. And so that's why we work so hard every day to reduce the number of positive cases and to reduce the number of deaths in our community. And I thank each and every one of you for your participation in lowering that curve and reducing the number of positive COVID-19 cases. In Florida, we have 33,690 positive cases with 1,268 deaths. You may have seen yesterday, Governor DeSantis released his plan for opening the state back up. And so we are currently, and that when I say we, I mean the Emergency Policy Group, which looks out for the entire county, consists of 3 county commissioners, school board chair, the sheriff, and the mayors of Temple Terrace, Plant City, and the city of Tampa. We met today and talked about what that looks like in our community, but it's pretty clear. Going to open up restaurants and retail to 25% of their allowable capacity. So we're looking at what that means for the city of Tampa, and we'll have more information out tomorrow so that we can inform all of our restaurants and our retailers exactly what we expect of them. Matter of fact, we've been working on that all afternoon. Unfortunately, we are still those services that really can't provide the 6-foot distance separation or have to come in physical contact with other individuals, and those would be hairdressers, barbershops, nail salons. Those types of services will remain closed for now. This order that the governor put in place has no timeline on it. In other words, it has no end date, but the anticipation is that we'll look at this every 2 weeks. As I have said all along, one of the most serious aspects of COVID-19 is the ease with which it's transmitted, and the silence. Quite often, individuals are asymptomatic. We're finding somewhere around 20% of the population, give or take, can have had the virus and not even know it. So they are spreading that around. So there are gonna be more cases as we release some of the restrictions that we have. There are going to be more cases. There's no doubt about that. So we have to do everything that we can to keep that number low. A lot of you have heard the term herd immunity, as in HERD, like a large herd. So that, the more individuals that get this virus, the more they'll build the immunity to it. But the only answer is a vaccine. And we will still have to have the same restrictions in place for those individuals that are at high risk. Also, have the same stringent restrictions in our assisted living, long-term care, and nursing homes. It's critical that we ensure the safety of the residents of those long-term care facilities. And so we will do that. So the governor has said that he's going to make decisions based on the science. And so what we're looking to do is to increase the number of tests that we provide. And we have done that. We've ramped that up. There are no restrictions for the tests anymore. If you want to get a test, you can go and get a test. You can go on Hillsborough County's website, and it tells you where those locations are at. You can go to our website, tampagov.net, and we have those testing locations. in the city of Tampa. We have Raymond James Stadium, and we have Lee Davis Center. So go on to see what the hours are, and also what days those tests are available. And call Hillsborough County 813-272-5900 to get a reservation for a test. So increasing the tests. Dr. Lockwood says we need 2,250 tests a day for our population. So we have to make sure that we're doing that. We have an accurate picture of the issue in our community. Also testing for the antibodies. Hopefully we'll get accurate testing kits for that, and we'll be able to see who has had the virus and has an antibody. Also doing the contact tracing to make sure that we've got individuals. If Jane Castor takes the test, it's positive, we can find out exactly who I came in contact with and make sure that they're quarantined and that they are all tested as well. Very important. And then the syndromic surveillance system built by USF and Dr. Holt to look at who's presenting in emergency rooms and physicians' offices with the symptoms. And then we map that geographically. And also the survey, while you're on Hillsborough County's website, take the simple survey and we'll map all of that information too. And that will inform us as to where the hotspots are. We can get resources in there quickly. So we have to make sure that as we open our city back up and we get back up on our feet economically, that we don't have a surge in these cases. Very important. And it's also critically important that we take care of our high risk individuals, citizens out there in our community. Very important. Hillsborough County, as I've said for several days now, they opened up a relief program for all citizens in Hillsborough County. That means it doesn't matter what city you live in Hillsborough County, just that you're in Hillsborough County. You can call, and if you have lost your job or your pay's been cut because of COVID-19, you can apply for mortgage and rent and utility relief. So please call in and do that. Don't get frustrated if the line rings busy or your call gets dropped. The overwhelming number of calls that are coming in, of individuals in need, it really just speaks to how many people have been affected by this COVID-19. But just keep trying, and trust me, they will answer your call and they'll take care of your rent or mortgage. And I'm very, very thankful to Hillsborough County for doing that. So also, please, while you're there, do the census, right, Senator?
Yes,
critically important. One, that determines how we get our funding by population. So it's very important that we have everyone in Tampa filling out, everyone in Hillsborough County filling out that census. And also determines our political representation in DC. So very, very important. It doesn't take any time at all. Census.gov, or just fill out the form that you had mailed to your house. And again, go to our website, tampagov.net. Has all the information you need there about COVID, about the relief efforts, about the testing sites, anything that you need to know. Go to tampagov.net. Very, very important. So now we get to my esteemed guest and my mother-in-law. I know. So Senator Janet Cruz, she's a Democratic member of the Florida Senate, representing part of Hillsborough County and Tampa since 2018. Previously, she served 4 terms in the Florida House of Representatives, representing a Tampa-based district from 2010 until her election in the into the state Senate. So first of all, thank you very much for your service and for your outstanding representation of our community. It is very, very much appreciated.
Thanks, Mayor. It's an honor and a privilege to be able to serve in my district 18, about 500,000 folks. Mm-hmm. And I want to also say to you and leadership in Hillsborough County, I looked at the graph that the governor put up yesterday in his speech, and the very lowest numbers on that graph, the lowest bar, was Hillsborough County. And we're a big county, and we've done an excellent, excellent job. People have, they're staying safe at home.
Yeah.
And that is so important. And I also want to caution folks as the governor starts taking these steps to open up our state that, Tampa, we are, we have a large inner city. We have a large minority population, which within our city of Tampa limits. And there you find multi-generational living. You have young people that are living with parents and grandparents and even a great grandparent. So everyone is anxious to get back to work. The unemployment system that we'll talk about has been an epic fail. So people are desperate to make a paycheck, but I will tell them that they should be cautious and make sure that they're returning to a safe workplace. Are there gloves? Are there masks? Are they safe?
Yeah.
Because a lot of folks are living from paycheck to paycheck and they'll be anxious to go back to work, but they have to stay safe.
Yes, without a doubt. And that's something that, that we talk about every day. And I try to sing that song because it is critically important. As I say over and over, the 2 steps that you can take that will really stop the spread of this virus is that physical distancing and the wearing of face covers. Those 2 steps are critically important. And then when you're out and about or you're in your home, especially when you're in your home, those disinfectant steps, disinfecting all of the commonly touched surfaces within your home, making sure that you're washing your hands. If there are individuals that are high risk in your home, wearing face coverings if you have to go outside during the day, it's very important because we can least afford to have individuals that are elderly or have some of those comorbidities to be exposed to this virus. It is incredibly easy to transmit. So, and that's very important. And this virus has shown in other areas throughout the United States to disproportionately affect Black and Brown communities. There are a number of health issues in some of those neighborhoods. And then also, as you pointed out, that multi-generational living conditions. So that's very important. And we want to be very mindful of that. So let's get right into unemployment. As we talked before, and I said, just about all these questions deal with unemployment. So how should people apply for unemployment benefits right now?
We'll try not to talk about the past and what a disaster our $77 million website has been. So let's talk about today, moving forward. The process has changed a number of times, and the most recent guidance is to apply at floridajobs.org and click and submit a claim. And it's florida.jobs.org and click submit a claim. Now, some people have indicated that the new directive is less than helpful. And if you have a claim that was marked ineligible, a portal should appear in your what we call Connect. And this all sounds kind of confusing, but once you get on there, it will make sense. Go into Connect and reapply. And you can also go directly to the new website that's been touted as better than before. And that is floridajobs.org/RA and then the word application. So it's RA application. And you can apply for the pandemic unemployment assistance. But if you reach out to my office and you're unsure, we're happy to help you. We're on the phones all day long. My number is 467-6830, 813-467-6830. It's a Google Voice number, and my staff will call you back. But again, all new applicants should go to floridajobs.org/RAA application.
Do you have any tips for applicants on this process? Like, is it better to go at a certain time of the day or?
Well, there are some people that were setting their alarm clocks for 2 and 3 o'clock in the morning because the system was so overloaded, but now they're shutting it down at night so that they can process more claims. So number one, you should keep very good records. Keep records of the day that you started attempting to apply. Take screenshots if you can. take notes on your conversation with the DEO, and claims should be retroactive. So you may be applying today, but maybe you've been out of work for 2 or 3 weeks. So make sure that you get what you are owed. And you'll want to have very clear records, since we cannot rely on this computer system to accurately reflect how long you've been waiting for benefits. So also, in the past, if you were self-employed or a gig worker, you weren't eligible for state unemployment. But the stimulus package that came down, the CARES package, provides for gig workers, and it provides for self-employed. So you should still apply through the same system. If you get denied, you should try again, because for some reason it's kicking out the gig workers and the self-employed, but there's federal money there for them.
Okay, I heard, I hope it was incorrect, but I heard a statistic of 40% of the people that were applying under the new system were getting kicked out.
You know, I wish I could tell you that it's an urban legend, but it's not, it's true. This system that we built was designed to be difficult. It was designed to make it hard to get unemployment benefits. And now that mainstream Florida needs help, it's really quite difficult. So we'll have to go back and revamp this very expensive website. But right now, I just want people to get their doggone money.
Right. I know you think of the frustration of losing your job and now, not being able to get that money back. It's very frustrating. So what other state resources are available for our residents who are in need?
Well, there's the emergency SNAP benefits, and some people may recognize that as food stamps. And there's also Medicaid and CHIP healthcare that may be available. And that's going to be the next swell. Folks that are working and businesses are going to go back at 25% rather than 100%. They may find themselves out of work for a very long time, if not permanently. And you may be offered a COBRA benefit to extend your healthcare coverage, but it's very expensive. And without a paycheck, that's an impossibility. So you should go on to the state side. It's myfloridafamilies.com and start anticipating what your healthcare needs will be before that system, which was built by the same people that built the unemployment website, before that system goes on overload. Take a look and prepare. I think that's that's really good advice.
Yeah, and go on for any type of assistance. Go on the website and see what documentation you need prior to, so that if you do get through, you've got everything right there and you can fill it out, and you have pictures you can upload, whatever it is that's necessary. Be prepared, because the last thing that you want is to spend hours trying to get through, and then there's a question that you have to disconnect to go and answer. So very, very important. So, and another thing too is I'm in touch with a number of different service providers around our city. And in speaking with some of them, the CARES Act, when they received some of that funding, it's dependent upon hiring back all of your workers. Well, when they call the workers to come back, they have to weigh between, well, I've got unemployment, which is a sure thing if they were able to get their application through and be accepted. And then, do I take my job back at the restaurant where I'm not sure you're going to survive for 6 months? So, that's a difficult issue that's been thrown in on top of everything else that is just frustrating and unknown. So what we're trying to say here is that we're here to help you with whatever the concerns are, anything that we can do to provide you with information or get you any kind of relief that we can. So many, you talked about the healthcare. That's a great idea too, because the last thing you can do is get caught without insurance and go on a gap with that. What are some of the ways that the residents can get assistance with applying for health insurance? Is there anything beyond what you said with the COBRA? Okay.
Yes, we have, figuring out what your needs are for healthcare can be confusing. A lot of people have always had their employers pick their plan and they contribute monthly, but you need to go to coveringflorida.org. And that's the state plan. And those are the Medicaid and the CHIP plans that perhaps you're not eligible, but there's a different threshold for kids. So maybe your children will be eligible if you're out of work. But there are also healthcare navigators that can help you. They can talk to you about the plans and help you determine your needs. So go to coveringflorida.org or 877-813-9115 to see if you're eligible.
Good, good. Okay, well, you talked earlier about in the governor's presentation how Hillsborough had done so well. And I think that the credit goes to all of our citizens because we passed that safer at home order relatively quickly, and the citizens responded just incredibly. They took that level of responsibility very seriously and stayed at home and avoided that contact. And so thank you to our citizens for doing the right thing. You have more than likely saved lives. So very appreciative of that. And also, before we go, Dessa's chewing on a Zephyr's bottle, so I need to grab that. This is what Dessa does during the day. Chews on our, uh-oh, I think we may have lost our senator. There were a number of services that are available for individuals, for everybody that's out there. We talked about the unemployment. We have our relief system, One Tampa. The Hillsborough County is doing the relief for individual citizens as well. But I also want you to know that there are other nonprofits that are helping. Metropolitan Ministries, Feeding Tampa Bay. I talk about them quite often. I go out and I volunteer, and it's just the number of people that are assisted with food is just incredible. So come out to those locations. It is an absolute wonderful service, and they're providing you with enough food to last for a week. Also the Crisis Center. You know, if you're feeling overwhelmed and the stress of losing a job, homeschooling your children, wondering where that next paycheck, wondering how you're going to pay your bills, the Crisis Center is there for you as well. So we have a number of service providers that are here for you. And I just want to make sure that everyone avails themselves to it because we are in this together. Now I have a couple of questions from social media questions. Terry Schultz Cutting is asking, it seems to me that Governor DeSantis is not following federal guidelines to reopen. We have not seen COVID-19 cases plateau for 14 days and we don't have enough testing. Dr. Fauci, who is a national hero, that's my personal opinion, not Terry Schultz, said that none of the states that are reopening are following these guidelines. I hope that here in Hillsborough County, we will be taking things a little slower in order to prevent cases from spiking. I feel very strongly that when people are in stores and pharmacies, they should be required to wear a mask, not when exercising. So far, you've done a great job of protecting us, Mayor Castor, and I trust that you will continue to do so. Thank you, Terry Schultz Cutting. I appreciate that very much. I think what Dr. Fauci was referring to, the states were Georgia and South Carolina that basically just flipped the switch and threw it all open. I think that our governor is taking a more measured step, and we are going to base our decisions in the science. As I said before, we have tested just over 1% of our population, but we have ramped those tests up dramatically. So we'll have that data to look at once we get the antibody testing, the contact tracing, the density risk, looking at those areas in our city that are the most densely populated, whether it's horizontal or vertical. And those are the ones where this virus can spread so quickly. Think about high-rise buildings or locations where individuals live in close proximity. So we are doing that to make sure that we don't have a dramatic increase in the number of cases. But also, I also have a responsibility for the economic health of our community too. And I do believe that we are doing this in a very thoughtful manner very slowly, incrementally. So if we have to turn back, we will be able to do that and tighten up again. You can't do that if you just, open up the floodgates and let everything back to normal, which is definitely not what we're doing. Okay, Donna Dorigo Stockford asks, do you think that we should have waited a couple of more weeks before starting to open up Florida? Also, do you think we should not allow travelers coming in or going out for a bit longer? Well, travelers were never stopped from coming in to Florida. Well, they were stopped literally and asked to quarantine as they crossed the border in vehicles. And then as they came into the airports, they were given basically a sheet of paper that asked them to quarantine for 14 days. But everyone has been permitted to travel into the state. Again, we have to pay attention to those individuals and watch, not necessarily to those individuals. We have to expect that they will take their personal responsibility seriously. And then also just make sure that we're paying attention to any of those hot spots where we may be having outbreaks. So the wearing of the facial covering, I tell you, that is critically important. And it's one of the things that we are going to require here in the city of Tampa for all of our retail and restaurants that are getting ready to open. And they're opening at 25%. And so we're going to do everything we can to help them get back on their feet. So I believe that is, oh, here's another one. Lenora Roth. When can patients see their optometrist and dentist for routine checkups in Florida? Monday. So make an appointment.
That's awesome.
That's right. Make an appointment tomorrow. Let's see. Oh, this good return there, Senator Cruz. So
Lucky,
Boyer,
I'm
not saying that right. She wants to know why there's one unemployment phone number to call for 1 million plus people. If there are 20 people handling phone calls and they take 25 calls a day, that means an average of only 50 people a day are able to speak to someone.
Well,
okay, go ahead.
I will tell you that they have hired 2 call centers. Okay. So that number gets directed to hundreds of people. So okay. It may just be one number, but there are hundreds answering the phone now. And, they recently hired those folks. So folks should be, someone should be answering your calls now.
Okay, good. And this Hockey Girl Tampa, first of all, love that name.
Yep.
But this is just sort of a question and a comment, which you've already answered. It says, why does Governor DeSantis keep promising they're fixing the unemployment system, but we're still left with no answers, no money, no idea of how we're supposed to keep treading along? So we hear your frustration, Hockey Girl Tampa, and hopefully with the employment of these 2 call centers, that things will start moving along a little bit quicker.
And Hockey Girl Tampa can call our office, Mayor, and we'll try to check on her claim.
Okay. Excellent.
And sometimes the answers that we receive are no better than the answers that Hockey Girl can receive on her own, but we're certainly happy to try.
Well, good. And then JB wants to know if FPUC payments will be paid out in a lump sum if they're ever paid.
There is retroactivity to claims. So the answer is yes, your retroactivity should come to you in one lump sum.
Okay, well, this, Scott, again, this just sounds like airing out the frustration. Yeah. Is there any reason that Florida can't or shouldn't just pay right now, all capital letters, the 800,000 unemployment applicants who are waiting for their first checks? Some have been waiting for 2 months. The state just keeps saying they're fixing the system.
Well, I'm going to say a bad word, Mayor, because we have been hollering for that same thing. I have been thinking with the secretary, and they continue to go on about how they're so worried about fraud. And I said, are you kidding me? These are not a bunch of fraudulent claims. These are people out of work. Said to just pay them the damn money. It's $275 a week. it's the difference of food on the table for some folks or lights in the house. So just pay the people, pay them. If you have to claw back some money afterward because you think you found something fraudulent, then claw it back. But people have been waiting 6 and 7 weeks without money. A lot of folks don't have credit cards, and their debit cards are on zero. So they don't have the luxury of putting it on a credit card till the money comes in. We need to pay Floridians. We need to pay them.
Amen.
He's right.
Amen.
He's right.
Yes. Okay, Stephanie McNeely says, safer at home is the right way to go for Tampa. Thank you for always fighting the good fight to keep us and our vulnerable populations alive. And she is a Tampa nurse. So Stephanie, thank you for that. But I hate to inform you that the EPG voted today to cancel the safer at home order once Governor DeSantis's order for the state takes effect Monday night. Sunday night into Monday morning. I was the lone no vote on that because they can both coexist. And if, pray to God it doesn't happen, but if there is a surge in the number of cases here in our community, we would be able to address that through the safer at home. Now we can put another order in place as well, but I just felt that there wasn't a need to do away with our safer at home because it isn't isn't in conflict with what the governor put in his order. So, but we thank you, Stephanie, for your service as a nurse to our community on the front lines there. All right. Well, thank you so much, Senator, for
Thanks, Mayor.
providing us with that information. Thanks for helping everybody out with the unemployment and making sure
You're welcome.
are getting their
And
money.
Mayor, our city did well because they trust you and they believe in you and they've known you for a long time. So I want to thank you for the guidance that you've given we Tampanians. We were happy to listen to you and we trusted what you had to say. Still do.
Well, thanks. I appreciate that. All right, everybody, remember, it is karaoke dance party at 6 o'clock. So you got to get out there and dance. We're just going to do this until Sunday. So you just have a couple more days to get out there and dance like nobody's watching. Tune in to your favorite iHeart radio station. I don't know what the song is this evening, but I'm sure it will be wonderful. So go out there and dance and send us your photographs at City of Tampa and your videos and photos to hashtag Happy at Home TPA. All right. Thank you guys very, very much. Remember to text Tampa Ready, Tampa Lista to 888-777-777, 888-777, and Tampa Biz to 888-777 for real-time updates on the virus and on relief efforts. You can also call our recovery hotline. That's 1-833-TPA-INFO if you want to talk to someone. So we are closing out this evening. Again, thank you all very, very much for tuning in today. And as I said before, we will get through this together. Absolutely, no doubt. So be safe, be kind, stay healthy, and above all else, stay at home. Thank you all and God bless.